The next two tests I'm going to demonstrate are for a distal biceps tendon rupture. Have the patient seated, elbow flexed to 90 degrees, forearm supinated. Biceps is a supinator. If you notice, my right arm is coming underneath her arm and then just gently stabilizing the forearm. What I will have the patient do is just very gently flex the elbow, I'll ask her, and then I'll take my fingers, 2 fingers, and I will try to hook the distal biceps tendon. A negative test is you can hook the tendon. A positive test is there is no tendon there to hook. You can't, there's nothing there to grab onto. Another test you can do called a bicep squeeze test. We're now going to put the forearm into pronation. And what we're going to do is just come and squeeze the bulk of the bicep. Now what you can see when I squeeze her bicep is just a little bit of motion into supination. It's not dramatic, but there is some motion when I squeeze the soft tissue of her bicep. You'll see her forearm just supinate a little bit. That is a negative test. In the absence of motion into supination of the forearm is a positive test for a distal biceps tendon rupture. Understand that a distal biceps tendon rupture is going to have a mechanism of injury with a very clear history, and especially in the acute stages is going to have a fair amount of ecchymosis on the anterior aspect of the elbow. So this generally isn't something that you're going to be dependent on 1 or 2 tests to decide.